Hi, this is Monica Mathis, MD with Medical City of Denton in Denton, Texas. Patient Kimberly G. Harrison, case number 0573-94, was admitted into the emergency room on April 7th, 2017. She complained of extreme abdominal discomfort, gastrodynia, nausea, indigestion, bloody diarrhea, and jaundice of the skin. Once in the emergency room, she did begin vomiting blood, also known as hematemesis. She said that the pain and discomfort had become so severe that it began to interfere with and hinder her daily activities the last few weeks, so she decided to come in. She did state that antacids, she took some and it did not end up helping with the nausea or the indigestion. She has no known allergies, and past medical history does show that she has had past gastric infections of the bacterium Helicobacter pylori. So upon physical examination, her vital signs showed that her temperature was 98 degrees Fahrenheit, her pulse was 74, and her blood pressure was 120/66. So she's 5'5", weighs 145 pounds, and based on her symptoms, my initial thoughts were gastric cancer. So I did order a CT scan and an upper endoscopy. The CT scan did show some tumors in her stomach, in the lower portion of her stomach, and after doing the upper endoscopy, we did see some gastromalacia and some gastritis along with those tumors in the lower portion of her stomach. So based on these findings, I did go ahead and preoperatively diagnose her with gastric cancer. So we decided to do a partial gastrectomy. So we did place this patient underneath full anesthesia, went ahead and prepped her for surgery, and went ahead and removed the lower portion of her stomach. So we went ahead and connected the upper portion to her stomach, or of her stomach, to her small intestines. So final diagnosis based off of my findings while in the surgery is that she does have or did have gastric cancer, but I want her to go ahead and follow up. She currently is in the hospital, but I wanted her to go ahead and follow up with you, Dr. Smith, to go ahead and discuss the possibility of some chemotherapy with you to make sure she doesn't end up having any of this cancer spread. So if you have any questions, please don't hesitate to get in contact with me.